Okay, so I decided to do my presentation on medication waste and how much money are we throwing away. I know that waste of equipment is a huge problem, and medications are super expensive. So I wanted to explore how much is being wasted and what some strategies we might be able to use to reduce the medication waste in our facilities. An estimated $700 million in prescription medications are thrown out every year. I did some math on it. That equates to about $147,000 per hospital per year. So to get staff motivated, maybe think about what could your hospital do with an extra $147,000? What equipment might you be able to buy? Maybe everyone could get a raise or an extra day of PTO. That money at each hospital in the United States could go a really long way. I found this video that highlights some problems with certain states, and I just thought some of the numbers were kind of interesting. It doesn't want to play for me. Let's try this one more time. Here we go.
A study from Express Scripts on healthcare spending found that $418 billion was wasted in the United States during 2012 on bad medication decisions. Waste is classified as money spent that did not improve the clinical condition of a patient, like higher-priced medication rather than generic, or unnecessary medical expenses. The study shows that over $55 billion was spent on higher-priced medication when cheaper equivalents were available. Mississippi wasted the most money on unnecessary pharmacy costs and is also the state with the lowest median income. 9 of the 10 poorest states were found to have wasted the most money on medication-related expenses. Residents of Mississippi spend an average of around $1,600 extra on medication during 2012. The results show that the state of Vermont wasted the least amount of money on pharmacy-related spending, with an average of just over $1,000 per person. Steve Miller, Chief Medical Officer at Express Scripts, said, "It's hard to believe, but when we consider associated medical expenses, bad pharmacy-related decisions waste more money than what the country spends in total on prescription drugs."
So just kind of an interesting, a few little interesting tidbits about medication waste and how much is actually wasted. So why is so much wasted? Getting to the root of the problem. One of the problems cited in this study I found that manufacturers produce unnecessarily large packages. For my facility, we don't have an on-site pharmacy, so we get an order, we fax it to the pharmacy, and they send us usually 30 days worth. But and they'll, if it's an antibiotic and it has an end date, they'll only send us as much as we need. But if it has an indefinite time period, maybe we need to order less drugs each time. Pharmacy usually comes 5 or 6 days a week, and so do we really need to be ordering a 30-day supply at each time? Prescribers write for long-term use of a medication, again, something without an end date, so it just keeps getting sent and sent and sent, and we end up with a lot of extra. And then sometimes the medication is discontinued early due to side effects, so we might order it and we get a 30-day supply, and 3 days later we find out that the baclofen we ordered is heavily sedating our patient and we have to discontinue it. Well, now we have 27 days left of medication that we just have extra sitting around. And then there are things, just mistakes happen. Sometimes, again, we don't have an in-house pharmacy, so oftentimes we're making our own concentrations and we're mixing our own antibiotics, and we make mistakes, and sometimes they spill, and sometimes we mix them incorrectly, and again, sometimes we get too much. I know for our babies, they get erythromycin, and we get a whole bottle of erythromycin, and it will expire before we can even use half of the bottle, and we have to throw it away. So what can be done to prevent waste? One of the things I found in the book that was really helpful was using managed care to ensure proper communication and proper use of resources. So risk sharing and exporting risk means that rather than The risk all being on the consumer and the insurance companies. The provider takes some risk, so they have a stake in it. They have a reason to try to reduce the waste. If we're overprescribing and underutilizing medications, that we can't get reimbursed for those. Also, ensuring a pre-authorization from insurance before we order something. I know that sometimes our physicians will write for something and then we have a back and forth with insurance on whether or not it can be approved. And that wastes time and money. And sometimes the patient gets sicker while we're waiting for the med. And so we need to make sure and have clear communication with everyone. Avoiding medications to last for a long period of time. Say, for example, with an antibiotic that we start, we want to try a dose first and make sure that our patient doesn't have a reaction to it before we order all 5 days worth of the antibiotic, because if we end up having to switch for some reason, now we've got, and potentially pre-mixed IV antibiotics that have to be refrigerated that now we might have to throw out. And then looking for generic options when available or a biosimilar. I did a little bit of research and I looked into the Procrit, which costs about $2,000 a month for the user. And the FDA has just approved something called Retacrit, which is a cheaper alternative, but it's not a generic. So not necessarily just looking for the generic medication, but something that's similar or that might work the same, that saves a lot of money, that is at a reduced cost, might help bring costs down and bring our waste down. We can also perform frequent medication reviews and eliminate unnecessary prescriptions, especially at my facility where we've got a lot of long-term patients that have been there for years and years, and they're on a lot of the same medications that they've always been on. And if we can do a medication review, we might be able to get rid of some or change them to those generics or biosimilars that are less expensive. Another idea was to treat expensive medications like a narcotic, for example, that Procrit, that each dose is super expensive. Making sure that we double sign it out, that you verify that we're giving the right dose. If we're mixing meds, to make sure that we're not doing it incorrectly and have to throw it out. And just making the floor staff aware, hey, this medication is very expensive. Obviously, we want to be cautious with all of our medications, but just being a little bit more aware of what's going on and the costs that are going into everything. Another big one is, I know at least at our facility, we have a big drawer of discontinued medications that once they're not on that med anymore, we'll take it back and we put it in a cupboard. And right now it is overflowing with meds. And I found 2 studies that 19% of returned medications from home can be redispensed. So someone gets a prescription, they pick it up, they never use it, they bring it back, it's still sealed, it could be recycled. And with hospitals, since, for us, we have the bubble packets, so you can see if it's been tampered with, 90% of medications returned to pharmacy can be redispensed. And so that would be a huge savings if we were just a little bit better about getting medications right back to pharmacy so they could be repackaged before they expire. We could save a lot of cost there. And then why does it matter? Why is it important? Healthcare costs in the United States exceeded $3.5 trillion, and that equates to over $10,000 per person. That's a lot of money. I don't know about you, but I could use an extra $10,000. So medications make up 9% of healthcare expenditures, and they're definitely not the largest portion of healthcare expenditures, but there is a lot of waste involved, and I think there's a lot that we can do to make it better. And then not just for our hospitals and for our own raises and to be able to afford better staffing and better equipment, but 1 in 5 insured Americans reported problems paying their medical bills in 2015, and that's not counting uninsured Americans who obviously are going to have more trouble paying their bills. So we need to be our patients' advocates and do everything we can to keep costs down for them. Insurance coverage makes a lot of patients and providers insensitive to what they're using. I know that more than one patient has said to me, when I say, oh, we're going to reuse this, or I don't want to get extra because it's going to cost you. They'll tell me, well, insurance is going to pay for it, so I don't really care. So maybe doing a little bit more education for our staff members and our patients about why it's important that we are conscious about our spending. There was another study that they sent back medications to pharmacy that were unused, and at the end of the study, 3 months had gone by, and one hospital saved $5,000 just by recycling medications. And so, just asking the question again, what could your unit do with that extra $5,000 every 3 months? And again, we are advocates for our patients. We need to do what's best for them, and we definitely need to make some changes. So hopefully by recycling when we can, performing medication reviews, and using managed care, we'll be able to get our medication costs down a little bit.